Hey there, and welcome to our channel. If you're an expecting mother, this video is for you. Pregnancy is an amazing experience, but it can also come with a lot of discomforts. That's why we're here to talk about coping with some of the most common pregnancy symptoms. We know that dealing with symptoms like nausea, fatigue, heartburn, back pain, and swelling can be tough, but it's important to remember that they're all a normal part of the journey. The good news is that there are techniques to help manage them, so you can feel as comfortable and at ease as possible. So, sit back and relax as we guide you through some practical tips to help you cope with these symptoms. We hope that by the end of this video, you'll feel more informed and prepared for what's to come. Nausea and vomiting. Nausea and vomiting during pregnancy can be a very uncomfortable and frustrating experience. It can occur at any time of the day, but is most common in the morning. Some women may experience it throughout the entire pregnancy, while others may only experience it during the first trimester. It is also common to experience nausea and vomiting when traveling, or after eating certain foods. The main cause of nausea and vomiting during pregnancy is the surge of hormones, particularly estrogen and progesterone. These hormones can cause the muscles in the digestive tract to relax, which slows down digestion and allows food to remain in the stomach for a longer period of time. This can cause a feeling of fullness and discomfort, which can lead to nausea and vomiting. Fortunately, there are many ways to manage nausea and vomiting during pregnancy. One effective strategy is to eat small, frequent meals throughout the day instead of 3 large meals. It's also important to stay hydrated by sipping fluids throughout the day. Ginger, whether in the form of tea or candy, can be a natural remedy that can help alleviate nausea. If home remedies don't work, there are over-the-counter medications that can help. However, it's important to talk to your healthcare provider before taking any medications during pregnancy. Some medications can have adverse effects on the developing fetus. In extreme cases, when nausea and vomiting are severe and persistent, it is important to seek medical attention. This may be a sign of a condition called hyperemesis gravidarum, which can lead to dehydration and other complications. Your healthcare provider can provide you with treatment options and monitor your condition to ensure the safety of you and your baby. 2. Fatigue. Are you feeling exhausted and drained during pregnancy? You're not alone. Fatigue is a common symptom during pregnancy and is caused by hormonal changes as well as the physical demands of growing a baby. Fortunately, there are some strategies you can use to manage your fatigue. First and foremost, prioritize rest and sleep. Take breaks throughout the day and aim for 7 to 8 hours of sleep each night. Regular exercise can also help boost your energy levels, but be sure to consult with your healthcare provider before starting any new exercise routine. In addition to these lifestyle changes, it's also important to maintain a healthy diet. Eating a well-balanced diet with plenty of fruits, vegetables, and protein can help combat fatigue. Finally, don't be afraid to ask for help from family and friends when you need it. Taking care of yourself is the best way to take care of your growing baby. 3. Back pain. Back pain is one of the most common symptoms experienced during pregnancy. It can be caused by several factors, including the weight of the growing baby and changes in posture. To manage this symptom, there are several strategies you can try. Regular exercise, such as prenatal yoga or swimming, can help build strength and support the back. Maintaining good posture throughout the day can also be helpful in reducing back pain. It is also important to avoid heavy lifting during pregnancy as it can cause strain on the back muscles. Using a pregnancy support belt is another strategy that can help alleviate back pain. This type of belt provides support for the lower back and abdomen, reducing the strain on the back muscles. If the back pain persists or becomes severe, it's important to talk to your healthcare provider. They may recommend additional treatments, such as physical therapy or massage, to help manage the pain. In some cases, medication may also be necessary, but it's important to consult with your healthcare provider before taking any medication during pregnancy. IV. Heartburn and indigestion. Heartburn and indigestion are common pregnancy symptoms caused by the physical and hormonal changes that occur during pregnancy. The expanding uterus puts pressure on the stomach, which can cause stomach acid to back up into the esophagus, leading to heartburn. In addition, the hormone progesterone slows down digestion, which can also contribute to heartburn and indigestion. To manage heartburn and indigestion during pregnancy, there are several strategies you can try. One effective strategy is to avoid trigger foods such as spicy, fatty, and acidic foods, as they can increase the likelihood of experiencing heartburn. Eating smaller, more frequent meals throughout the day can also help reduce symptoms. This is because smaller meals are easier to digest and put less pressure on the stomach. Over-the-counter antacids can also be an effective way to alleviate heartburn and indigestion during pregnancy. However, it is important to talk to your healthcare provider before taking any medication during pregnancy. Some antacids contain ingredients that are not recommended during pregnancy, and your healthcare provider can recommend safe and effective options. It's important to note that if heartburn and indigestion persist or are severe, it's important to seek medical attention. In some cases, persistent heartburn can be a sign of a more serious condition such as gastroesophageal reflux disease, GERD, or peptic ulcers. Your healthcare provider can evaluate your symptoms and recommend appropriate treatment if necessary. Versus swelling and edema. Swelling and edema are common symptoms of pregnancy caused by increased fluid retention in the body. This can make certain body parts, such as the ankles and feet, feel puffy and swollen. To manage these symptoms, there are several strategies you can try. Firstly, it's important to prioritize rest and elevate the affected area whenever possible. This helps reduce swelling and improve circulation. Gentle exercise, such as walking or swimming, can also help improve circulation and reduce swelling. If swelling is severe or sudden, it's important to contact your healthcare provider immediately. This could be a sign of preeclampsia, a serious condition that can affect both the mother and baby. Your healthcare provider may recommend additional measures such as compression stockings or medications to manage swelling. Overall, it's important to listen to your body and take care of yourself during pregnancy. While some swelling is normal, sudden or severe swelling should be monitored closely by your healthcare provider to ensure a healthy pregnancy. In the end, pregnancy can come with a range of symptoms that can affect your daily life. However, by understanding the common causes of these symptoms and trying some of the strategies we've discussed, you can manage them and alleviate discomfort. It's important to note that every pregnancy is unique, so be sure to communicate any concerns with your healthcare provider. By taking care of yourself and being mindful of your body's needs, you can have a more comfortable and enjoyable pregnancy experience. Thanks for tuning in, and we'll catch you in our next video. Don't forget to like this video and subscribe to our channel.